All right, so we're going to talk about how to progress nerve glides for the upper extremity, specifically the radial nerve in this case. The example we're going to use is we're using Evan here, and we're going to assume he has a radial nerve problem on this arm, so opposite side arm. And I'm sorry, we're going to assume he has a radial nerve problem on this arm, and it's going to be severe enough that he's not going to tolerate a full radial nerve test. So if I go to wind him up and do a radial nerve tension test, he's not letting me do it, or he's in excruciating pain. So with patients like that, it becomes tricky to how to dose nerve glides, because we know we need to treat the nerve, and everyone's first instinct is to offload or treat the surrounding structures in some way, and that is the first step. We just kind of want to get into a little bit of the nuances of how to go through that process and eventually get towards nerve gliding. So if this is his symptomatic arm, he's got a radial nerve problem, offload, radial nerve tension test, again, he wouldn't tolerate this, but it's going to look something like that. So the opposite of that is going to be like this. If we've ever seen somebody with a really irritable radial nerve, they probably come into the clinic holding their arm on their head, or they put it there and they'll be like, yeah, this is what I do when it's hurting, because it offloads it. So that's an offloading position that he's going to like. So, he can put it on his head like that. And then from there, I can take the opposite side and I can wind him up into a radial nerve and just say, okay, Evan, you just hold your arm there. So on this side, he's doing a radial nerve tension test on the opposite arm while offloading this side. So same thing like we did with the legs. If you watch that video first, we offload the side that's painful by taking it out of tension. Then we tension the opposite arm to further draw tension away from the symptomatic side. So once this becomes more tolerable, we can take this arm and we can do a nerve glide with the opposite arm. So when I'm here, he feels a little bit more tension in the symptomatic side. When I wind up the opposite side, it takes away some of the symptom in the symptomatic side. And then once that becomes a little more tolerable, we can work his arm down into a position of less tension, and we can continue doing the same thing. Or if we need to, we can position the asymptomatic side into tension again and give him a static position. It just kind of depends on what he presents with. If he presents and he's not ready for the next progression, well then we might just put him there and let him offload for a little while, and that might be his home exercise program for that day. But again, we're trying to move to a more dynamic movement, and so gradually we're moving this farther into tension while flossing this side, eventually to where the opposite side is held in tension. Hold your arm there, Evan. And then we'd come around to this side, and we might move from very little tension into a little bit of tension, or depending how he is, if he's progressing well, we'd move into more tension and he's flossing this way, gradually releasing tension on the asymptomatic side, putting that there, tensioning the side where the problem is. So now we're getting to the point where we can get full nerve excursion on the symptomatic side. But that would be the progression. That'd be the progression that we'd go through for someone with a highly irritable radial nerve. And the same is true for the median nerve. If I can't bring him into a median nerve position up here, well, I'm probably going to put his symptomatic arm something like this, because that's pretty opposite of the median nerve tension test. So that, we just have to think about the positions of the nerves themselves when they go into tension, and when they need to be offloaded, go into that position. All right, guys, hope that helps.